This patient was referred to me for endodontic treatment of tooth number 19, porcelain crown. According to the patient, the crown is about 2 years old. Patient had a big filling in the tooth, and her dentist recommended a crown. Patient says after the crown, tooth never felt right. And recently she noticed she called it a blister on her gum. And that would be it. That's the blister she's talking about. That's the tooth right there. And that's the blister that she was referring to. In medical terms, we call this a parulus, and we call it a buccal parulus because it's on the buccal side of the tooth, on the cheek side of the tooth. The other side towards the tongue would be the lingual side. Lingual. All right. So this is a buccal parulus. Tooth was tendered to percussion and palpation. Probings were 2 to 3 millimeters all around. Right here, the probing was 6 or 7 millimeters, but that's not a representation, actual representation of the periodontal condition of this tooth. This was just the way the probing depth here did not mean anything, did not mean the split tooth or a vertical root fracture. It just meant that there was drainage from that space, from that deep pocket. All right, so if you look here, you can see what I'm talking about. So you can see large periapical relucencies. I mean, look how huge these are. And this is where the deep pocket was, right here. So all of these, what I, in layman's term call pus pockets to the patient, I call these pus pockets so patient can understand. It's just that all of this pus is draining, all this purulent is discharging through that deep pocket. So I would consider this a endoperio condition situation here. Endoperio. Okay. So we went over options with the patient, and of course patient wanted to try to see if we could save the tooth, and that's what we did today. Went through the porcelain crown and did this root canal for this patient in one appointment. And take a look. And here's the post-op. So as you can see, 2 mesial canals. Look at that beautiful tongue, snake tongue action right there. And look at all of this anatomy in the distal root of the tooth. There's a lot of anastomosis between the distal canals there. And as you can see, very nice anatomy associated with the mesial root. Everything went great, as you can see. We went ahead and temporized the tooth and refer the patient back to our dentist for the permanent restoration. I'm optimistic that buccal parulus will go away within the next 2 to 4 weeks, and recommended that the patient came back to see me in 6 months for a post-op check. And if she shows up, then I will make a video and post that on my various pages and channels.